Lung cancer is the leading cause of death in the United States, and it claims more lives each year than colon, prostate, ovarian, and breast cancers combined. But now there's a new treatment option for patients living with the most common form of the disease. Dr. Edward B. Garin from the UCLA Johnson Comprehensive Cancer Center joins us now with this hopeful news. Hi, doctor. How are you?
I'm doing well, thank you. How are you?
Well, thank you. So tell us about the latest statistics on lung cancer in the U.S.
So each year, about 200,000 patients are diagnosed with lung cancer in the United States. There are some patients who are diagnosed at an early stage of disease where approaches like surgery, which can get rid of the entire disease, can be utilized. But unfortunately, in most cases, patients present at a time when they need more extensive therapies, often including therapies that would distribute throughout the body. About 15% of patients with lung cancer have what is described as small cell lung cancer. It's just the way it looks under the microscope. But for the great majority, about 85%, they have non-small cell lung cancer. And non-small cell lung cancer, in many respects, is a collection of different diseases that all sort of come together as lung cancer. When I say different diseases, a lot of times these, excuse me, are driven by different mutations. And when we use the word mutations in this setting, these are not inherited mutations. These are mutations that would happen in a patient's own cells and are integrally involved in those cells being cancerous.
Okay, so tell me why it's important for NSCLC patients to determine their mutational status at the point of diagnosis.
Yeah, it's very important that that patients who are diagnosed with non-small cell lung cancer can identify what the mutations are, because at this point, the treatment algorithms are very different based on what somebody's molecular abnormalities show. The approaches that we have traditionally taken, chemotherapy-based approaches, for instance, may be appropriate for the majority of patients, but there are specific abnormalities where it has become clear that that what we describe as targeted therapies that would be specific for the mutation that is present in the patient's cell, is a better therapy than standard therapies, both with respect to better effectiveness, but also a lower level of toxicity. And this has been shown now in multiple different treatment approaches for different mutations, that in general, we see that if there is a targeted therapy available, that prioritizing that therapy and making sure that the patients are able to get it early in their care is helpful in allowing patients to do as well as possible for as long as possible.
Okay, doctor, we're running out of time, but the FDA recently approved Tabrecta. Tell us real quickly how important it is.
So I think it's important. This drug is for patients who have MET exon 14 skipping mutations. These mutations are seen in about 4% of non-small cell lung cancer patients, but 4% of a large number is still a large number. And so many patients now who did not have a targeted option before this approval now have a drug that is available that is both associated with a high likelihood of shrinking their tumor, as well as keeping their tumor at bay for good periods of time. And the tolerability also has been in general good, which I think is also sort of reassuring, certainly, about the agent.
All right, doctor, thank you so much for all the information. We appreciate it.
Thank you very much.